name is Herbert Kipiego Chemos, the hospital administrator. We also give the influenza vaccine, that's flu vaccine, so that it can protect the children against the allergies. In a day, as Bungoma Children's Clinic, we see a total of 50 and above children in a day. And also we see children that's below 18 years and below. Bungoma Children's Clinic, we have two specialists, that's pediatric consultants. And they are well versed with children, and they do wide range of complete physical examination since they are well versed with children. So since there are people who can't explain themselves, our pediatricians always do a complete physical examination and also detect what's ailing the child, and also work hand in hand with the parents, since the parents are the best nurses for their children, since they spend most of the time with the children. With the history from the parent and also physical examination from the doctor, it's when they'll get a complete history and also get the right diagnosis and right treatment.
Bungoma kunajulikana sana kuwa na sickle cell.
In Western region, specifically Bungoma, the rates of sickle cell disease is high. And as Bungoma Children's Clinic, we normally run the sickle cell clinics. We run throughout the week. And for the pediatrician available, they normally recommend every checkup, and also we have wide range of vaccines that protect those children with sickle cell, which one we give them since their immunity are compromised. We normally, as the pediatricians who see the children, they normally recommend for meningitis vaccine, pneumococcal vaccine, and flu vaccine, since those children, their immunity are compromised, and we give them those ones so that they can be protected. And you see most of the children now, like those who are having sickle cell, they normally spend most of the time in the hospital. Now, as Bungoma Children's Clinic, we decided to introduce this vaccine so that they can help them, so that they can live a healthy life as other children.
Maybe
As per now, with the trends that are going on with the finance bill, and you see most of the people, we are in the low level income. I think most of the people will be affected, since there is no that income generating agents that will help them, since the taxes that are going to be imposed will lead to people not going to the facilities, since they'll be having the low income.
maybe the last question about the
Bungoma Children's Clinic, as earlier said, is our fastest growing children's center in Bungoma. And we began as a clinic, and as per now, we are that level of a hospital, since we've moved from the clinic to a hospital. And our referral system is, we are connected with different facilities, that's the referral centers like MTRH. So when one or two children are, the management is not that way that we can manage, we normally do a referral system to either higher level so that the children can benefit. And also, as Bungoma Children's Clinic, we've incorporated many insurance that we have got Britam Insurance, APA Insurance, Liason, Madison Insurance. We have also the Kibabi University Insurance, Kaimosi University Insurance. We also have Old Mutual Insurance, Trident Insurance, and many others. And that also helped to increase the coverage population, since because of the economy, you know, most of the people depend on the covers. And that's why Bungoma Children's Clinic, we decided to incorporate these covers so that we can help our community and make our children have a good health. We we work as per the WHO guidelines and the government policies. So we don't deviate from the normals. Since we are also in the DHIS and we are also recognized as a Bungoma Children's Clinic, and because of doing what is required as per government policies, we work hand in hand with the regulation set and also the recommended WHO guidelines so that we can give our people and also our community the best. Thank you.
Priscilla Nekesa Haemba. I am a resident at Bungoma, Namuyemba location. I used to stay in Nairobi, but I moved here in December last year. And coming here, there was a challenge because in Nairobi we are used to getting pediatrician in many facilities. But here when I came, I went to district hospitals, public hospitals, and the queues were long, the services were not up to par, the vaccines were not readily available. So we kept on being told, especially for Rota, you will come for the next visit, maybe it will be here. But kids were not getting the best. So I got referral from my sister-in-law who stays here. She told me that there is a hospital called Bungoma Children's Hospital. They have pediatric services. So I opted to come. And when I came, the child was having a lot of allergies. In our bloodline, there is asthmatic issues. So she was having a lot of challenges, but Dr. Lubanga was so effective that has been able to journey with us. And now the child, when we were here, she was only 1 month old, not even 1 month. I think it was less than a month, but now we are at 8 months and she's doing fine. She's being well managed. Even here we came and the services are good and she has responded well and we are grateful. So the private hospital, especially Bungoma Children's Hospital, has been good and very supportive to us as parents, and we really appreciate it. The problem we are having with the vaccines is that when we want to opt for the government, especially for the parents who don't have like covers or that financial capability to visit the private institutions, when we go to public hospital for the vaccination, we are not able to get all the services that are needed. Sometimes you are able to get half of the vaccines, like KP. Those normal injections are there, but these other things like Rota or any additional services like that influenza is not readily available there. So you find that our children are really coughing, they're suffering with flu in, day out. But when we are able to come, like I recommend Bungoma Children because it has been so pocket friendly. The consultation fees are good. Even the services we get, in vaccinations, we get at a good rate, and it has been helpful to us. It has come in to bridge that gap that we have been experiencing with the public hospitals. I would like to advise fellow parents that as human beings, there's always infection, there's always disease, but we always, when we stay in a rural setup like this one, we will have our parents or advisors who will always tell us the different stories. They give us real life example that so and so was like this, and we took them here and there, and they were sorted. But I advise that the important thing is to get the child to the health facility, let the child be assessed, let the child be treated. All diseases are treatable. All infections are treatable and well managed if only you take the child early enough to the hospital, to the facility, and to the right doctors who can be able to help them. Caretaker, you will always know how your child behaves in normal circumstances, like they are playful, they eat well, and they are jovial. But at a time when it comes where the child is now docile or fusy, irritable, is not able to feed well, then that is the time you get an alert that maybe the child is not feeling well. So you are able to pick from her communication, the way she's communicating. She might not be able to communicate verbally, but she'll give you the signs that will indicate that all is not well. And at that point, or maybe she is having diarrhea or having vomiting issues. For that, straight away, you will have to take the initiative of taking the child to the hospital.
General question.
I would say that one I will say that change is always as good as rest. As the saying goes, that if you do not change, if you do not embrace change, change will change you. So change is something that is inevitable, and we are objective that we appreciate that the government is also doing their best to want to make things easier for us. So we believe that the stakeholders in health section have done their best maybe and done the research maybe to learn from the issues that has been affecting NHIF, that maybe they have improved when it's coming to the new technology. So we just wait and see, but NHIF has been good in the rural areas, and we just hope that this other new method that they are introducing will be much better. Honestly, as Kenyans, we will request that the government has to be run, yes, and we are the one who are the main stakeholders as citizens to make our government run. But the issue with the finance bill 2024 has been a bit tough for the locals and for the mwananchi wa kawaida. So we will only humbly request for the president and the stakeholders to kindly check into it and adjust where we feel like it's pressing on us, the issue that we have raised. We are not saying that they abhor everything, but at least they try and work in the safe margins with the minimal taxation so that we can also be able to enjoy being in our country. Thank you.
Maybe what is your message to CS kwenye nyumbani na watoto na wafanya?
CS Nakumicha, we really thank you. You are our lady from Bungoma, and we are happy that you have put us on that board. And we pray that you look in the public sectors. Let's also have those vaccinations that are needed on time, so that our children can acquire the best startup foundation in health, so that they can grow up to be the champs they are. Because it's so demoralizing when we go to the health facility and you are told, Mama, there is no vaccination for Rota, and you just know how the danger of the child undergoing diarrhea or vomiting. And now you are scared because you don't know, you are psychologically traumatized because you know that your child is not protected. So we kindly request that you put a priority on the vaccination so that it can be able to boost our children and so that they are effective, so that they grow up well. Thank you.
Story huyo mtu anaweza fanya story, anaweza kubali.
Ndio tu.
Iko na patient, utapiga patient. Hello. Trisha, please, mommy, please. Nizeke sana kanizungusha kilipo.
Hapa.
Waambie watembee polepole.